Hello, in this video I'll be talking about what to expect when your hair grows back after chemotherapy. Before I go on, I want to invite you to subscribe to our channel and to invite you to go to yerbba.com to get your personalized report about treatments you might be offered and what to expect moving forward. So just to go over why we lose hair with chemotherapy, chemotherapy affects rapidly dividing cells, and the most prominent ones it affects in a bad way, good for you, bad for the cancer cells, are those cancer cells. They're dividing more quickly than normal cells, and chemotherapy in particular will kill them. Now we have other rapidly dividing cells in our body as well, and this video in particular relates to your hair follicles. So when people get chemotherapy, they can expect to lose their hair, usually after 1 to 2, maybe 3 cycles, depending on the drugs, the schedule, meaning how often you get it, and the particular schedule. So if somebody gets it every week, it's a lower dose of some chemotherapy, and the hair loss can take a lot longer. I'm not going to go into the process of losing hair. We have another video about that. We also have a video about different ways to help prevent hair loss, in particular scalp cooling devices that I'd love to encourage you to watch as well. But what happens when chemo is over? What can you expect in terms of hair regrowth? Well, one thing to be aware of is that some people have their hair start to grow in while they're on chemotherapy. A lot of people ask, does this mean the chemo isn't working? It does not mean that. It's just something we see in some people. So let's say your hair hasn't started to grow during chemotherapy. Now chemo is done. What can you expect? In the first few weeks, you'll start to notice that you have a very fine fuzz on your scalp. And this can occur in other parts of your body where you've lost hair as well. So the hair grows in, and it's a very soft, almost baby soft kind of hair growth. That's the newest, youngest type of hair. After a couple of months, you may have as much as 1 to 2 inches of hair, and it will often stand straight up on the top of your scalp and be flatter on the sides or the back. It doesn't all grow in at once. So in the very front, it can take longer for some people. So don't be upset if it seems to be slower in different parts of the scalp. The hair actually varies. That's why different parts of our hair will be gray at different times in our life. As it grows in, you may notice that the texture is different. It may be much softer, or some people find that it's coarser or thicker than it was before chemotherapy. After 3 to 6 months, your hair should have grown in on most of your scalp. There may be some areas where it's a little thinner, and it's getting longer. It might be, 3 to 4 inches, and again, the texture might be different. As you go from that 3 to 4 to 6 months to 12 months, your hair may be as long as 4 to 6 inches. Everybody's hair grows differently, and after chemotherapy, hair can grow more quickly as your body sort of rebounds from the effects of chemotherapy. At a year, you'll get more of a sense of the color of your hair and the texture, and you may notice again that it's straighter or it's curlier. You can color your hair after chemotherapy. There's no concerns about doing that. Some people decide this is the time they're going to go natural and not have to do the upkeep of coloring their hair every month or 2. What about ways to take care of your hair? We recommend using a gentle shampoo and rinsing your hair really carefully. Don't use extra hot water. You'll want to use cooler water. Take really good care of your scalp. As your hair is growing in, you may want to massage your scalp, those sorts of things. But just try to stay natural and not use harsh chemicals, with the exception of color, which is not used, of course, every day. What about supplements and diet? Omega-3 fatty acids, vitamins, and iron may be things that, again, you want to get in your diet whenever possible, but may help. There's some thought that biotin can also help, but this isn't proven to help. Some people find it useful to try to do everything that they can, but I don't want you to think this is going to be the answer to all problems. Occasionally, people don't have their hair grow in again. Most oncologists have seen this in 1 or 2 patients over their long career. If this has happened to you, this is really hard, and we never want to minimize your experience. But for others watching, the vast majority of people do have their hair grow in, and it grows in thick. If your hair was already thinning, you'll see some of those same things persist. Drop a comment or a question below. Share your experience with the Yerbba community. And as always, thank you for watching.